Hey everybody, it's Kevin and it's Zane, and we're talking healthcare tech. And today, you guys have to figure out if we're actually us or we're just a digital version of us talking to you. Just kidding. But in all seriousness, we're seeing more and more pushes toward digital humans being used in different care settings and using avatars and those kinds of pieces. We'll talk about the pros and cons that Zane and I have seen on variations of that right after the reel. All right. So one, I've missed you, Zane. It's good to see your face. Two, I did throw a curveball towards Zane because digital humans, I don't feel like is just like a common part of the vernacular. So Zane and I have both been talking about digital twins, and Zane did a bunch of prep for that. And then I swept the rug under him, and we're going to talk about digital humans. So break those down, Zane, kind of the difference since you're very up to speed now on digital twins. What's the difference between what we're talking about in digital twins in medicine and digital humans, what we're talking about today?
So digital twins is basically you make a replica, basically a computerized replica of whatever. Usually it's a product, a physical product, but they're talking about using it for us human beings, right? So you can prep for surgery, you can see how a medication could possibly interact with it, or how they would react, or how their bodies would react. And a digital twin is different from a simulation in the sense that it's taking in constant information, like real-time information, and kind of updating itself, versus a simulation. You're kind of checking one thing at a time. But we can talk about that more in later in the next episode. But digital human is basically kind of, I think the easiest way of doing it is kind of like basic, like a digital version of me, right? Like I don't have to be sitting here, but it's trained on how I am. It's trained on my facial features, my mannerisms, and so on and so forth, and it can interact with you. So you're basically talking to a virtual version of me. So instead of like just doing it via chatbot, we're just adding a person's face to it, or body, both of them, everything.
A little bit of everything. Yeah, I think that the big push. I know that a little while ago there was a post that was kind of related to this saying. They basically took some information from just the FDA in a drug sheet, and then pulled it over and used their own voice to then make a digital human talk about that drug to someone, so that you could just have someone basically regurgitate some of the counseling points, related to that drug. And so it made me think, in general, like one, what were some problems with that I thought were an issue? But two, what were some of the benefits of having that happen rather than just giving someone a sheet of paper and saying, Godspeed and good luck? So that was the example that kind of spun in my head first when I was thinking about how are we going to apply digital humans in this like medical world. But even before that, the use of avatars, maybe not humans, but you and I both remember back, sorry, Zane and I are older, but but with the little paperclip, the Microsoft paperclip, and all the other little avatars, you could switch them to the dog and make them bark and that kind of stuff. Like that was interestingly engaging for me as a young person, like to see that on a screen that seemed like it was actually interacting with you to a certain degree. And so I can see it having some advantages when it comes to chronic care. I think of that immediately because acute care, like there's some acute need for those individuals, but chronic care, you can lag out, rather quickly on. I thought this was something I wanted to pay attention to, and then now I don't. But if you had a virtual buddy, would it make it better? What are your thoughts there, Zane? What are your first kind of impressions of using digital humans in healthcare or outside of it?
I think the number one place we'll probably see it first is kind of like your digital buddy, in the terms of like loneliness. Like I think there's a big epidemic happening around the world and COVID kind of made it go further, as people are more separated now than ever. And I think that so I think we'll start seeing digital humans primarily in that space right away, because it's something that, I mean, if you think about it, like it's already happened. Like there's games that have been produced like way back in the day, like your simulations of life and whatever, that people get really involved in. So I think that's where you'll first see it and kind of humanize it. They'll be like kind of humanizing it versus just like, a text or whatever. I do think that there is, so I struggle with this, and I'll be honest, like I think there is some advantages and disadvantages to, like, let's say for example, you're picking up a prescription, right? Like we're automating the pharmacy process. you're picking up a prescription from one of those kiosks that, if you ever go to Home Depot or Lowe's, you can it just opens a window and you grab it. And then you go and say, you go back to the window and you're paying for it, right? You can have a digital pharmacist, technically speaking, like that pharmacist talking to you when they're not there, and they can regurgitate, the proper counseling points. You can ask it like, hey, do you know anything about this medication? Yes or no? And it can kind of do that part. But then it's still, and kind of to your initial point, what's the difference between paper versus hearing? I think people learn much differently. Right? Sometimes you just don't have time. You just give them paper, and how many of us actually read it? Probably very little. I was actually very surprised whenever patients said, "Oh, I read the package insert," or "Well, it's not the insert, that's for us," but whatever. And I was like, "Really?" So I think there is some benefit to that. But then also, are we removing the human aspect from medicine? Are we making it? I don't want to say like it's making it more streamlined, but that's just my only thing. I don't think I mean, that is a negative with any technology that keeps moving on, because I think people in general we keep separating ourselves with technology, when in reality I think it should be the other way around. With technology, we should be helping us get more together, but that's not how technology is being used currently. I mean, look at social media, look at what they're trying to do with AI, all that stuff.
Yeah, I think social media is a really good example. And funny enough, I just had a conversation with a buddy just the other day about how we have at the push of a button thousands of people that we could connect with like immediately, and yet we don't. Like, we probably are lonelier and more isolated than ever before, and that's evidenced by the loneliness worry of all medical professionals, especially with the geriatric population kind of coming forward. So that a few examples, I guess, Zane, to bring us back to like, where could this be applied? Like, where could we use digital humans, like inside of healthcare in general? There are four main areas that I wanted to get your thoughts on that I kind of broke down. And the first one is the patient education and engagement. You already said it, like, yes, you can grab this information, put it into a digital human, have them regurgitate it to a certain extent, maybe a little bit smarter. Right now it's developing, so it can be a little bit smarter and more cognizant, so to speak, neural networky, about getting some feedback and understanding, like, how is the response? What does Zane's face look like? Does he have additional questions? And then making additional like iterations of that piece. And the engagement can be, literally something is looking at you and talking to you, as opposed to, there's that sheet of paper that was in that bag that I threw away already. And so I think there's a benefit. But what about the virtual health assistant, Zane? What about there is someone that pops up rather than just a reminder on your phone. Now you just named your virtual health assistant Billy. And so Billy now pops up on Zane's phone to say, "Hey, Zane, it's time for this." Is that something that you feel like is beneficial, or could be?
I think it could be. I'm trying to think of it like, like I'm trying to think of like Iron Man and stuff with Jarvis. I mean, Jarvis you never actually see, but kind of that.
Yeah,
I think that would be pretty cool, personally, but I don't know if everyone else would be cool with it. I think that, I mean, we have to be honest. We have to get over the creepiness factor of it first, right? Because that's the biggest hurdle. Not biggest hurdle, but that's going to be one of the hurdles, right? You really want somebody looking at you all the time, or keeping up with you, and then putting a face to that. I would be interested to see. I mean, I didn't look into this, but maybe if there studies out there that show that, hey, having, I mean, I'm sure there isn't, because there's something that's being developed, but it would be interesting to study this to see how is, like, adherence or whatever versus, with a paper instruction and a digital person instruction, right? Like, that would be an interesting thing to see. And then also, I think that I would be okay with it in the sense that we can't be everywhere all the time. And I think that, with that digital human, you could theoretically speak in different languages. You can do different dialect, like all that thing that honestly I can't do, right? Like, but
right.
it's still representing me, or me as a person, right? So I think I would be okay with it. I think it would be an interesting thing to see. I think it brings more access, but again, access to what are we giving them access to, right? Like, we have to be very careful as to, not saying that patients shouldn't get their information, but there are, with AI ML models, unless it's like very locked down, there is hallucinations and things like, do we really know what it's telling them, right? I mean, we don't have to go all the way to the generative AI part. We can just do an indexing type thing, but those are things that we have to keep in mind, right? Like if it is outside of if we're not physically there to watch it or hear it, is it going rogue? Is it doing these kind of things?
Yeah, what are the properties that are being allowed for it to be displaying or recognizing, and what is it doing with that data, and how is it then redisplaying that information to the end user, being our patients? I think is a very legitimate concern, and that really ties into the other two elements of therapeutic support, like algorithmically, if this happens, this should happen next. So for example, someone starts having chest pains, and they can read their bottle of their nitroglycerin that says, here is how you take your nitroglycerin. Here is when you take the second dose of nitroglycerin. The need to be able to call medical services, in that time frame, like all those important steps, and helping someone to navigate that during a complex time, or using an EpiPen or naloxone, or whatever it may be, on just administration steps or algorithms. Like I can see that being highly beneficial to have something telling you that. Is it needed that it is a humanoid, like, I don't even know if that's the right term, but a human like individual selling that to you, rather than something that looks like a dog or a paperclip, or that it's not either of those? I've got to spell them because I've got both of them in the room, but it's an SIRI or an ALEXA, one of those that is just an audio only, right? And that's so funny because literally they're listening to me. But is it an audio only is good enough? Like, we don't need that other aspect because it might add, as you mentioned, the creepiness factor, which I think is very true. The last one was remote monitoring and data collection, which you already touched on, because what are they gathering, right? And how is it being interpreted? How is it being relayed back? Is another real question point when it comes to data accumulation. Because if like you're in a program that is gathering this information for you and trying to help you become healthier, fantastic. Some programs require you to have inputs and export that data, and others, or import, I guess, the data, depending on how you're looking at it. But others will automatically have that data be fed over to your clinical team. And so it's probably associated with it. But if you're gathering even more data, a la like Apple Health and some other things that are on your phone or on your wearables, and what information is going in and out of those kinds of spaces, now adding that to the whole healthcare conundrum, there is some additional oversight that I think we either, one, have to become comfortable with, because that's the new wave of healthcare and we need these data points to be able to serve chronic diseases better, or two, we have to do it in a way that the patient, I think both are necessary, that the patient controls. Your thoughts, Zane, on all of that?
I'm all for patient control. As you were talking about that, I was thinking, like, how do we own this? And I think that it's kind of an interesting discussion in general, not just, and sorry, I'm taking this kind of off the rails, but
Yeah.
but I think it's an interesting discussion. We moved a lot of things to the cloud, and I feel like more people are now, since the cloud has existed, people are used to it. I think some businesses are like, hey, we need to own our things and we need to own our stuff, and making a server, owning things like that has become cheaper and cheaper. So why couldn't you, and I might be a little biased because I'm looking into this right now actively, so maybe this is why it's top of mind for me, but why can't you host this thing in your house on a local server that you really don't have to do much? You just plug it in to your computer, plug it into the wall with an Ethernet jack, and it's just connected to your local internet, and it's taking all your data, and then you decide what data is going to your PCP and whatever. And I think that would be a cool solution. I don't know if anyone wants it right now. I will definitely be looking into it after this call if we can do something like that. But I think that's going to be the one thing. Before we even go down this road, I think we have to decide who owns this data and why do they need to own this data, right? I think there's no question about the patient owning their data. That is, it's your body, right? You should own that part of it, but we don't. And I think that's a conversation that needs to happen. It's not going to happen. It isn't happening. I think there's a lot of people that just don't care or just don't know how valuable their data is or what's happening with their data, which is, just life in general, I think. But I think that's the number one question. But because you can't just have a free flow of data, because then when you have all this data, it's great to have data, right? What are you going to do with this data? You don't have the infrastructure to take care of what it is, right? So that's the other thing. we all, me included, just love to jump into the solution, right? Oh, we're going to do this, we're going to do this, we're going to do this. But does the infrastructure exist to even support something like this? No. Right now, no. There just isn't an infrastructure that exists currently. So I think we would have to go backwards and say, okay, who owns the data? What are the rights to? Who owns what rights to whatever? Do we have an infrastructure where all this data that's flowing in, can it be used? It's being housed somewhere. That's it. Well, why can't it just be housed at my house, right? Like if you can't do anything with it, I'm just gonna keep it with me. And then once you can figure out something to do it. So that's just kind of my thoughts. I'm kind of meandering all over the place, but
that is one of your favorite subjects, which I love. So I knew that was going to pull you into that, which makes total sense. Like, how do we own it? If we're going to add human-like aspects, right, to this digital human approach, a very logical question is, how do we keep the human elements, and how do we keep the humans actually protected from all of the information that could be exchanged between them and the digital human? Because maybe this opens up that door for them to have even more open conversations. I'm going to do it the opposite way, Zane. So usually you go pros and cons, but we're going to go cons and pros. So cons that I kind of had listed out or thought of was limited empathy or ability to connect, like with that human being. Like they don't have the, like they can build stories, like as they start to learn from other people, they could have connecting. Like I've done this, like as a healthcare provider, total, like full transparency. I said, I've had patients that have had similar experiences to this or issues with this or family members or whatever the case is, but it's secondary to me. It's not something I've actually gone through myself, but I'm able to relate to those individuals I'm speaking with because of a shared experience from someone else. So I feel like that could be an argument against me, but what are your thoughts on that limited empathy and connection, Zane?
100%. I mean, I would say that we as humans maybe are not the best at empathy, but at least we can understand. I mean, to me, I haven't seen an AI model that's empathetic. I mean, at least me personally, physically, maybe there is something.
Yeah.
But I mean, empathy is a big thing in healthcare, and it's easy to say, oh, whatever, we can just do this, do that, unless you physically are going through that thing where you are finding no help, no one cares about what you're saying, or all that stuff. I think pharmacy, we are in a very unique situation because we end up seeing the patient in a time when they're usually pretty upset because they've been tossed around the healthcare system all over the place, and we are kind of their last stop, and we can't really go anywhere because we are the last line of defense, kind of, right? Yep. So we get dumped on quite a bit. So I think as a pharmacist, we see this part of it. Like we see the frustration. I'm not saying other healthcare professionals don't, but it's just like I think that we just have a unique insight into it. And we're being yelled at for things that are completely out of our control, right? So imagine somebody that's being told all these things. Imagine, like, I come from the oncology world, right? I can't think of any of my patients that would have liked to be told from an AI human that they have cancer. What is that AI bot going to do when the family's crying or whatever? Are they just going to keep pushing on like, oh, you have cancer? And then they, like we would look at them and see how they're doing and whatever. Will the AI bot just keep moving on? Well, these are the next steps, blah, blah, blah. They're like bawling. Are they really listening at that point, right? So, I mean, are we really helping them? So that's like the biggest con. I don't think, unless it's something that I haven't seen or whatever, but empathy is a big thing. And I think it's really dangerous for us to overlook that part of it.
I'm not to pull that study up, but I know that is one line that if I know my friend Zane is going to talk about something of AI and oncology, like someone just got cancer and delivered from an AI is something that you will say, which I appreciate that because you've been there, like you've seen that. The one fascinating thing to me is the studies that have looked at like Chat GPT or other LLM responses versus clinician responses in written format, and how they viewed the LLM responses to have more empathy within them than the clinician responses. And so I wonder, when you translate that over to, physical presence and audio, back and forth with an individual, the one thing that you can't replace, no matter how good it is, like it could be fantastic at empathy, right? That AI will not go through what you're going through and has not gone through what you're going through and lost another human being in their life. Right. And so I think that in general is the one thing that will always separate it. Even if the communication is better, We should have them write emails instead of having a physician, or the bedside manner of a physician is absolutely terrible, because I've heard physicians say things to patients that I thought, like,
Yeah.
who's your mom? Like, how did you get raised to talk like that to other human beings? But that aside, they are still a human being, right? And there still is some relatability. And thankfully, thank the Lord, there are still nurses and other colleagues that are around, even some of those less skilled individuals, to pull up the slack, And so I think there's a lot to be said there. Moving on to technical complexity. I think that's where you and I both are at. Like the technical complexity of the humanoid, like to be able to interact at this level. Like there's so many complex interactions of facial gestures and movements, and knowing someone's personality, what they're going to say next, why they're not going to say it, and then what to take from that, and then how to take that information and then reutilize it to benefit the patient. That I know that we're growing quickly, but I have not seen anything that has been that good. Thoughts
Yeah,
on
no,
that?
yeah. I do want to go back to that study that says that the chatbot was more empathetic.
Yeah.
If I remember correctly, they were going based on one of their measures was number of words or something, right? Like how long the answer was, and all
Yeah.
that. And I don't think that. I think there was some. It was an interesting study, but there's flaws to that study, and I don't think people should just kind of like use that as kind of the gospel of like, hey, this is it. That's all I wanted to say. But it was an
Fair.
interesting study, and people should read it. But to your point, the technical complexities, yeah, I mean, the only way I've seen facial expressions like really in real time doing it is literally when the camera is on the person's face, right? Like they're literally talking and there's an AI projection of them. I mean, all of us have played video games. Well, maybe not all of everyone. And when you're interacting with NPCs and things like that, when it's not a cutscene, maybe I'm going too nerdy for people. We make fun of those NPCs, the way they look, the way they're acting, the way all this is going on. Like, so the video game industry has been trying to do this for a very long time. They do motion capture, they do all these things. They put like, whatever all over you. So it's still something. Like it's gonna feel very artificial, and that's the one thing. Like yes, there are some things that can make it feel real, but again, that's literally when the camera's in your face and it's taking a picture as you're physically talking. But the whole point of this is to kind of multiply us. So then that kind of throws that part out of the window.
Hit it on the head. I can't say anything more. Privacy and security, we already covered those kind of components. Misinterpretation and misinformation, you already talked about, with hallucinations potentially happening. And, I think we dumb down human language much further than we should. Like there's lots of sayings that if you came from one part of the world versus another, you'd have no idea what someone is using when they're using like an allegorical speaking, or they're trying to be ironic or sarcastic, or whatever the case may be. Like those kinds of things are not easy to pick up on, like, and they're not always intuitive to someone. And so I wonder right there, when it comes to misinterpretation, if it doesn't even have to be misinterpretation that someone said something they didn't mean to say, because that's something as healthcare providers you also have to be able to pick up on, is instead of just going along with what someone said, you can stop the individual and say, hey, I heard you say this. Did you mean that when you said it? And that's another important skill, that you can know someone or be able to read someone's body language and see if they might not have had as much confidence saying something as you interpreted them saying it. Anyway, your thoughts there, Zane, on that misinterpretation piece, since we went into misinformation.
Yeah, I mean, I think the misinterpretation, I mean, easily, like, right. I mean, I'm sure, I mean, you can always ask, AI chatbots, and I'm assuming the same thing with this is like, hey, can you clarify this? Can you talk about this? But the problem with relying on the user to do that, the user needs to have some sort of baseline knowledge, right? That's one thing I think gets overlooked a lot is, yes, generative AI, all these things are great, but we need to know, you need somebody with some sort of baseline knowledge to say that, yes, this is the right answer, or no, this is not the right answer, or maybe we should go a little further, or whatever, right? Like a lot of times I can tell, and I'm sure you had the same thing. A lot of times patients don't ask you, oh, can you explain that? It's us having to ask them, right? Like a lot of times I say this, I mean, I've said this story a couple of times. I mean, you can see the like deer in headlights in their face and all that stuff. So you kind of go back or slow down, or like I would say like, hey, what can you please teach it back to me just to make sure that I did my job properly? And then that's when they're like, oh, can you go back and explain this, or can you or how do I take this, or can I take it with food or not? And even though I talked about it, but it's just like there's just so much information coming, right? Like if we do go down this road, maybe we can do something where it's kind of like a drip campaign where the first thing they're talking about, hey, this is the medication you're taking, this is how you take it, or whatever, right? Like, oh, this is why you need to take it. Then the next one could be, hey, this is how you take it. Like maybe if we do go down this like digital human route, I would like to split up education over a week, multiple weeks, where they're only getting the information that they need at that time, right? Sorry, that's not really part of this, but I was just kind of thought that's in my head.
Totally. I think those snippets might improve it overall. The one thing that it won't improve is human interaction, though. Like the human interaction replacement is the one thing that we've already mentioned. There is a huge gap in care. There's been several statements made by multiple organizations about that being one of the most concerning health issues of the next 10 to 20 years is loneliness and the depression, anxiety, et cetera, that will cause, and compounding chronic illnesses. And I can't think of any way that will necessarily help in that overall space. I'm sure there'll be lots of interesting psychology studies, to look at how these things can change the way someone looks at loneliness. There's also like human replacement when someone gets a pet or an animal or something else, or plant, that will allow them to have some connection to something else other than themselves. It can be, overall beneficial from a psychological standpoint. But I do think that it feeds into needing people less, and I think that's the interesting piece for me, Zane, is YouTube. Right? Really simple example, massive like educational benefit. But before, when I needed to call someone to be like, hey, how do you do this? Or how do you find this? Or what's the best way for this? Now I can type that into an LLM and I can look it up on YouTube, and then I can try to figure it out myself, depending on how mechanically inclined you are, and the amount of information you need to really have. And so I feel like this is really similar, when it comes to the relationship element. So how do you feel, I guess, before we move on to the pros and kind of transition to the pros, how do we take the 24/7 availability, which is an advantage? You and I both know that humans can't be everywhere at all times. How do we take that and insert the human element to get the best of both worlds?
I don't really know, to be honest with you. I think that we need to, outside of limiting access, I don't think you can really do it. I think that it needs to be, and this is going to get more into like a philosophical discussion, but I think that we need to recreate our like community structures back up again, which is completely outside of this, right? Like we need to have that, because that structure is eroded over time, right? I mean, I think I read somewhere where, America is one of the, like, you'll have the amount of friends you have in America is like, I don't know, like 5 or 6 or something. And like other countries, like close friends are up to like 20 plus, right? Because their culture is that, right? So I think you need a cultural shift. If you look at Japanese culture, right? Like they're talking about how they're elderly. A lot of them are alone or dying alone or this and that. That's a cultural thing. That's not something that just started right away, right? So I think that, like, I mean, from where I come from, like South Asian culture, everyone knows everything about everyone. I mean, it can get a little frustrating, but like when somebody's in the hospital, there's a horde of people that go there to the hospital, right? I mean, can we say that about the American culture? No, like that community aspect of it is being eroded away, and even in our culture, that's slowly being eroded away as more of us are growing up in this country. So I think that's more of a, and this is, I hope this is not, I'm trying to make it a cop-out answer, but you need a cultural change for that to take place first. I think technology is always going to be there. It's always going to do that. I mean, the whole point of technology is to make things easier to find, to get, to make, or whatever, and that in by its nature is going to limit our conversations with other people, right? So we need to start building conversations with other people around other things, right? We need to make relationships more, because before relationships were transactional, right? Now we're coming into a time where, okay, why do I need to talk to this person? Like we need to build stronger relationships, right? Outside of just like, oh, I'm going to call Kevin because I need to know how to build a cabinet, right? No, I just need to call Kevin because I like him, right? I think that's the shift that needs to happen in our culture. Again, sorry, this is completely. I don't even know if that answers the question, but that's
Actually,
just in my mind.
it's actually beautiful because it's my steal this idea moment. We need to coin that. But the steal this idea moment is really this. I think AI, if done correctly, can take our minds and go, you need to call this person.
Mm-hmm.
You need to talk to this individual, right? Instead of it just being all about, I can answer all your questions, you need no one else. If AI can recognize loneliness and be able to pattern it into a place that you can say, hey, fantastic, we can go from connecting with other human beings to saying the AI can tell you, you are lonely. You haven't seen these individuals. You care about these individuals. What would be great? Send them a text message, give them a call, do a FaceTime. Like, I think that element can really add to the personalization that we want to see, and that community building, because I think that's a beautiful piece. So I only have two more left. I know we're running at the end of time. And then actually my aunt was on here. Hi, Annie. How are you? Thank you so much for the interesting discussion comment. Meet my buddy Zane. So with that, the reduced healthcare burden and the scalability piece are the other two like elements that are put into play. So I'll kick those both over to you, Zane, for kind of final comments on using these humanoid pieces. To repeat them: reduced healthcare burden and scalability. I think you could basically combine them. But your thoughts on why that is a big pro with this idea?
I think scalability is a big pro, especially right now. There's a lot of people leaving healthcare, a lot of good people leaving healthcare just because of various different reasons. So we need to be able to multiply the people that we do have. So that, I think scalability is one thing that we definitely need. Healthcare burden. I think healthcare burden, it could decrease, but I think we have to it'll only decrease if we use this technology in the proper way, right? If we're just force feeding this, like for example, right? Like there's AI chatbots on Target, all these other, like when your customer service chatbots, right? But yes, it does help with like the quick answers. But in the end, when people really need to talk to you, they're going to try to, and when you're going through a phone tree, you're really frustrated. And instead of your burden is down, but now the people that are reaching out to you are even more frustrated. I mean, I don't know if that makes sense, but I think we just have to be really careful about, okay, yeah, we're going at scale. We're trying to reduce all these interactions and this and that. There's certain interactions that you don't need to reduce, that you shouldn't be reducing, right? So I think that's just my little like caveat to this. And I know people are probably getting really frustrated, but that is healthcare, right? There isn't a straightforward answer in healthcare.
It goes back to what you and I've talked about before about a CRM, a customer relationship manager. It's not that healthcare doesn't want to know their patients. It's just that they don't have time enough to get to know their patients because of this 7-minute cycling of individuals that, I'm almost tired of that statistic, but the 7-minute visit, is something that is very reflective of all of society. Like, we just don't have enough time. But I think the healthcare burden, like in burnout, is if we can leverage this technology to gather a massive number of data points, and instead of us having to compile them and look through them, if it can streamline it together so it makes a more cohesive experience for those patients and builds a relationship between healthcare provider and individual, I think that is a really fascinating thing to say. It's making us better. It's not replacing. It's not replicating. It is just adding on to the sophistication of one individual on how they can treat another individual. So they're all my tidbits for the day. Zane, any final words for us, buddy?
No, I think the biggest thing is I think we just need to make relationships non-transactional, to your point. I think as healthcare providers, we are told, or not told, but it's kind of like assumed, hey, don't get too close to your patients. Don't do this, don't do that. But I think that maybe we need to start changing that, because we're losing trust with our patients, and as AI is coming in, like we're starting, we're in this weird area, and then kind of going back to my cultural thing, like we need to start developing stronger bonds with people, and then all the AI in the world can come in, but we'll still at least have that to fall back on.
Love it. Follow Digital Thoughts newsletter potentially coming out. Zane's been really busy, so YouTube, follow all those new interviews he's been doing, and then check out RPH Ally on LinkedIn, Facebook, Instagram, YouTube, and enjoy all the stuff they're putting out there for you. And hopefully you'll learn a little bit as you go. Talk to you guys next week.
Bye, guys.